What is high blood pressure? High blood pressure is also called hypertension. High blood pressure is a condition in which the force of blood against the artery wall is way too high. There are two types of high blood pressure. There's primary hypertension and secondary hypertension. Primary hypertension for most adults, the identifiable causes are not identifiable. Okay, that didn't make sense. So usually this is a hypertension that just kind of gradually happens over years. Secondary hypertension is usually suddenly you end up with the hypertension and it's caused from something else, right? Age is a factor in hypertension. So age, usually about 64, it's more common in men than women. After 65, more women get hypertension. Family history, it runs in families, and there are some risk factors that can increase your risk factors, like the use of tobacco and how much stress that you have. If you have there's complications that can arise if you have high blood pressure. You can have a heart attack, you can have strokes, there's aneurysms. When the blood pressure causes your blood vessels to weaken and bulge out, that's what an aneurysm is. And then it also can cause dementia because your narrowing of the arteries in your brain is causing some of your brain to die. You have a systolic number and a diastolic number, so that's how you get your blood pressure numbers. When they give you your blood pressure, you have a number with a slash and then a number at the bottom. So the top number is called your systolic, which is the pressure that is when your heart is pumping, and then the diastolic is the bottom number, which is the pressure in your veins when the pressure is lower. So what can you do to prevent to get high blood pressure? You can eat healthy. That includes a low sodium diet, getting regular activity and exercise, maintaining a healthy weight, so weight's a huge risk factor as well, and then reduce your alcohol and tobacco use. There are medications that they use for high blood pressure, which include the thiazide diuretics, the calcium channel blockers, and the beta blockers.